Everyone, welcome to another episode of Coffee Chest of Claire. I'm super excited to welcome Victoria Watts, who went to the same high school that I'm going to, Menlo School. And I'm a junior right now, so it's really amazing that I get to talk to somebody and see the paths that led them to where they are. She was a recent Berkeley graduate and is currently working as a medical assistant before applying to medical school. Thank you so much for joining us here today, Victoria.
Yeah, hi Claire. It's so good to chat with another Menlo student. Thanks so much for having me on.
Of course. Let's start off with talking about your current role and responsibilities. Can you please tell me about your role as a medical assistant and some of your responsibilities?
Yeah, so I just graduated last May and I started working at an ophthalmology clinic shortly after as a medical assistant. Primarily, I help work up patients, taking them back and doing the machines, taking pictures, taking histories, doing all of the things before they see the doctor or optometrist. It's a joint practice. And the other half, I would say, is more administrative, calling insurance, making sure we're all ready for the patients when they come in each day. So just making sure that it's a whole smooth process, answering calls, emails, doing faxes, that sort of thing, and just communicating with the doctors and the patients to make sure everything is going smoothly for the patient experience.
Can you walk me through a typical day or week in your work and some of the most common tasks that you tackle?
Yeah, so each day is a little bit different. I work with two ophthalmologists and one optometrist, and so they kind of come in on different days. On Mondays, I would say is like our busiest clinic day where it's just one of the doctors all day and he sees about, I would say 70 to 80 patients, which is quite a lot in a day. And I think that was definitely something difficult to adjust to, but you get used to the sort of quick paced timing of the clinic and just kind of having this agency and, going from patient to patient. I think it's nice to hear their stories. I think some of the tasks that we do is um, managing the machines and operating them as a, I would say, like technician also of sorts. We are with the patient for the whole test. We are the ones, taking the scans. So you have your retina, optic nerve, visual field test, that sort of thing. And so with that can come some complications. Especially with the population that we do serve, it tends to be older. And so, accommodating for that if they're not feeling up for it, or they're a little like more tired, like sometimes you just have to adjust and either do a different test or just communicate with the doctor, like what their needs are, see whether they're taking their eye drops and medications, because sometimes it can be very stressful for the patient to remember things or pick the medications up from the pharmacy. And so just making sure that they like are following the doctor's instructions. And then also when things go awry, I think sometimes you have to think quickly on your feet. And so sometimes there are cases where you're taking the scans and you see something's wrong and then you let the doctor know and then we like refer them immediately to like the ER or like retina or cornea because we work pretty closely with those fields as well. In those cases, you really just have to like stay calm. But other days when it's less busy, I would say more 30 to 40 patients, there's a little bit more of picking up calls, welcoming the patient, taking payments. We also have like an optical portion of our clinic as well. So that's more like glasses sales. We take care of those too. Um, and so it's a little bit more like a, a mix of taking the patients back and picking up the phones and faxes, things like that.
It's really funny that you mentioned the optic nerve because in Mr. Hardy's anatomy and physiology class, we just did the 12 cranial nerves assessment and I
Right.
did volume. It was really funny too because she was sick then, so when we tested her swallowing, she like completely failed. But Yeah, I was also really curious about what kind of machinery that you use. Do you use like CT scans? What else? What kind of other machine do you
Not
use?
exactly CT scans. There's like three different main machines I would say we use. One is called like OCT, and oh my gosh, I don't know the exact science behind it, but it basically takes a picture of your optic nerves. And there's also a like take like let me think about this before. There's like the optic nerve, and there's one of your macula. And so basically it takes a picture for the doctor so that they can see each of the layers and um, basically like if the nerve is thinning in certain places, um, because those are things that you can't really see with the SLT slit lamp exam that they use in the patient room. And so that really helps them kind of configure like what they're going to do and thinking of before going into the patient room. So there's like, oh, has their nerve been like the same, been stable? Because usually we'll repeat these tests every kind of depending on the patient, 3 to 6 months or so, sometimes a year. And so if it's stable, then it's like, okay, good to go. But if it's thinning in some places and it's concerns from like, oh, should we be thinking about like glaucoma, um, macular degeneration, things like that. And so that's one of the machines. The other machine, it's called the A scan, measures the type of lens that we put in patients' eyes for cataract surgery. And so this is quite, I would say, important, or I guess they're all important tests, but like finicky machine because sometimes patients' eyes are longer than the others. So we're measuring for things like keratometry, like the curvature of your eye, um, as well as like how thick your cornea is, how long your eyeball is, just so that we find the right size lens to put in. Because, if you're off by just like a little bit, then it can make a large difference in how the patient sees afterwards. And so that one can take a couple of tries to get right. If not, or we want to double check that those measurements are correct, it's this whole other in-office procedure where it's kind of like an eye scope probe that you like put directly on your eye. We numb the patient first, and then kind of like squirt the saline solution, fills it up, and it takes the measurement manually. Doesn't hurt, but it's just a little uncomfortable. And then the last machine is, I guess we have two more machines. There's a visual field, and so you stick your head in the machine. There's like there are different lights that light up all around your periphery. And then click a button whenever you see the light, but you're supposed to be staring at the center. That one takes a little bit longer. Usually not the patient's favorite because, their eyes kind of get dry from time to time, but we give them some, lubricating drops to help. And then another important one is called the EIDON, EIDON. That takes a picture of your fundus, which is like the back of your eye, and you can kind of see all the blood vessels, if there's any like hemorrhaging, atrophy, all these other things, retinal detachment, let's see, like many other things. So that can kind of provide a fuller picture of where this patient's at in their, health, whether they're more stable or declining, that sort of thing. And it's very useful to the doctors. So those, I would say, three main tests are what we use on a day-to-day basis.
Can you share a success story or a positive outcome that resulted from your work?
Yeah. So before working, I wasn't very familiar with cataract surgery because, that's not something that's super on my mind currently. Um, but as I got to work with more patients and seeing them before and after cataract surgery, it has been, for lack of a better word, like very eye-opening to see how much impact that a surgery can have. So one patient, for example, she didn't have much vision in her right eye since childhood. And so like basically she was like hand motion, that she can only see like hand motion movements, couldn't see any letters. And after her cataract surgery, she came in and we tested her vision. She was like 20/40, which is like, it doesn't sound like, that great, but it's a huge improvement for where she was. Um, and I remember she was this kind of like elderly, like Cantonese patient. She kind of reminded me like of my, great aunt, and um, she would always come in with her son to help translate. And I would remember her kind of like with all the previous appointments. She kind of had this like very disgruntled, like jaded, like attitude about things. Um, but afterward, the doctor had mentioned when she could see quite well. I was like, oh, that's the first time I saw her like smile in a while. And like her son was definitely agreed. And she was like, yeah, she's been laughing a lot more. Um, just like being able to like see her son. And like, I think that was just a moment where it's really like, oh, vision is something you take for granted a lot of the times. And it's so great when, doctors can help like either restore vision or just get even a little bit back. It makes a huge difference in people's lives. And there's just like other stories, many, many other stories that are similar where it's like the patients are really, really grateful for any vision that they can get back, having like not had it for so long. And so I would say that is one success story that really stuck with me.
I feel like I can relate to that too. Like stories are so meaningful and everyone has their own personal stories. And yeah, that's such a meaningful story. And I feel like I'm also doing this podcast to like hear other people's stories too. So that's great. Thank you for sharing that. Let's switch gears to talk about your journey. When you were at Menlo, did you already know that you wanted to go into healthcare?
I definitely had an inclination towards healthcare or being in some sort of environment where I'm seeing like patients and like being able to provide some sort of service to them. I think I had a lot of exposure to physical therapy because of my injuries from dancing growing up, just overuse. I was constantly, in and out of physical therapy and seeing, orthopedic surgeons and things like that. And so getting to work closely with those healthcare professionals um, really motivated me to make an impact in other people's lives like they did for me. Um, I think it's so important that the role that they have on helping, you know, especially like I was, I don't know, maybe 14 the first time I had like been in there at physical therapy. And so that was really like a tough time for me, like when I just couldn't do any of my sports or activities anymore. And then like going back to activity was also like just as hard mentally. And so they made such a difference for me. And so I really was enthusiastic about taking anatomy courses and neuroscience and, biology in high school. I think that sort of cemented um, like those different interests for me. And then being a dancer, I sort of had this bodily awareness that really helped me like propel my interest in these like sciencey fields. And so I think I didn't always know I wanted to go into healthcare, but after those experiences and taking classes, I think I was pretty set on it. That was the path for me.
What was your major at Berkeley, and were there any classes that you found particularly interesting or inspiring?
Yeah, I majored in nutritional sciences, physiology, and metabolism. It's one long thing now. They're calling it metabolic biology. So that's a much shorter version. And some of the classes I really enjoyed was like anatomy lab. That was the first time we got to work closely like with cadavers and really seeing like in person. all of these muscles and how they connect and all the bones. It like really makes a lot of sense when you can see it in person and you can um, see with your own eyes and move it with your own hands. And then other classes I think were quite interesting were, I'm gonna say I really liked organic chemistry, which is odd because I didn't like chemistry in high school. Don't tell anyone that. Or I think it was just harder for me at the time, but in college, I think it was really fun because it was very like puzzle like and like pattern recognition. And so I think it was like a hard class. Don't by any means, it's not easy, but I think once you get used to like practicing every day, um, it helps a lot with, you know, making pieces click together, especially when you're taking all of these bio and, you know, physio anatomy courses where you're working a lot with like the same, you know, same compounds and chemicals and things like that. But I would say those were some of my favorite academic courses. I think one course that I took at Berkeley that's kind of more like fun was like an art design course. It was during COVID, so I guess I didn't get to experience the full, you know, joys of it. But we got to make like little like 3D models and like research about like design history and how it's evolved with the times. And I think that was just super cool. Like each week we got to learn and make something like physically. And so I think I really like that.
I'm really interested in your anatomy lab. Mr. Harding, my teacher, he always
Sure.
shows videos of like this German surgeon using cadavers. But what was it like first set experience? I feel like it must have been different.
I was initially quite nervous about it because I wasn't sure how I was going to react and like the smell of formaldehyde. Um it's very pungent. It like really pierces through your nose. But I think like the first day I started working with them, our professor kind of did a demo first, and showing us all the different parts. We kind of did it in blocks. So we would do like circulatory system or like the bones, like all in 1 week. And so we kind of separate it by that. And the professor would do a demo, basically not dissecting, but like going through each part of um, the body and pointing out and, you know, lifting the heart up, like showing us all these things. And so we were just like watching at first. And I think that was super helpful. But really, like, where I felt like I learned the most was when I would go in for like office hours or extra time in lab and like identify things on the body myself and move things around. Because that in combination with some of like the models are good, but sometimes it really doesn't showcase every single thing and how like in relation one thing is to another. And sometimes honestly the models are not all the time, but sometimes they're wrong. um, so I think really getting to see it in real life, getting to move things around, really helped me like identify why things though are the way they are. And I think anatomy, what is so great about it is that everything is in its place for a reason, like a certain purpose, um like our joints, like one like rotates around the other so we can have like these certain movements, like bending movements and um that in my head I was just like, oh, that's so cool. Like I don't know, I just found it was very applicable to like real life. And then I knew it'd be helpful to, you know, practicing medicine like down the line. Um, but yeah, I think the human body is really, really cool.
Yeah, I totally resonate with that. I didn't know that I would be interested into anatomy until I took it. And I was like, wow, everything's starting to make sense. It's like so much works together.
It can definitely be overwhelming. Oh, sorry. But
Oh my
it
god.
can definitely be overwhelming, but it is like just so cool. So every piece of information you can learn is really great.
How about overall while you were in college? How did you try to distinguish yourself in such a competitive field with so many other students interested in it?
Yeah, that's a good question. I actually purposefully didn't like try to distinguish myself in the conventional sense. I think at Berkeley there is a fairly large pre-med like community, and there's a lot of great clubs, um, and like events that go with that. Um, I didn't super like wasn't super involved with those clubs. I was part of them, but like I wasn't like you know the leadership part of leadership. Um, because I focused a lot on like my interests outside of those clubs. So like during college, I worked as a home health aide where I would like travel to my clients' like houses, and it was mostly like elderly patients, and so I'd have like one or two that I'd work with and um, stay with them, take care of them, take them to their appointments, like help them with their medications, also like memory things. Um, Throughout college, I also worked in like a physical therapy clinic as a patient service representative, as they called it. And so I found that I enjoyed just like getting experience, um, working with patients, working with healthcare providers. And I think like when you think of ways to distinguish yourself, think it's important to remember that you know, taking like prioritizing time to follow your interests is important. So like I would also say a lot of majority of my time in college was like towards dance and being part of like dance groups and competing, those types of things. And so I think, distinguishing yourself is easier than it seems, but you have to think about it like not in comparison to other people, because then I think it is really easy to fall into the classic pre-med student where you're just checking off a list of checkboxes, and so you kind of become this very robotic person where it's like I have to be part of X, Y, and Z clubs. I have to do research. I have to, you know, do volunteering, do this, which I think is important, but I think pursuing your own personal interests arguably is like more important. And I would say like that was how you stand out.
Yeah, I totally agree with that. I think having a balance of things, and it's really cool that you have dance as like some things to try that you have. Um, what were some of your challenges that you faced in your school or in your career, and how did you overcome them?
Yeah, challenges. I think there's a couple. One is learning how to ask for help, especially in in a large public school and these classes where like big classes like OChem and bio and those introductory courses where there's like hundreds of people, it can be very easy to just check out and be like, oh, I'll study this later and I'll get it. Um, and so when I first started, I had a really hard time because I'm like, how am I supposed to be, getting this and learning this by myself? Um, until I learned about like office hours. And like that's when you really have to like take the initiative yourself to go to your TAs and your professors. Like they're more than willing to talk to you and they're also like great people too. Um, but that is like really what helped me understand the material better. I know it sounds like, oh duh, like just go to your teachers, but it's harder than um you'd think with like time and like busy schedules and classes and extracurriculars like running from place to place. But I would say that is one thing that helped me get over like just like class difficulty challenges. Another thing, another challenge I encountered was overbooking myself. or overbooking my commitments. There was one semester where I started a research position on campus at the lab and while being part of a competitive dance team. And so the competitive dance team, I would say like the time commitment would be like, it would range from like 9 to 15, sometimes more hours, especially when like competition season was ramping up. But then research, we had also started like clinical trials. And so I didn't realize that would take up so much of my time because it was early in the morning, like sometimes starting at like 4, 5 a.m. and it would run to like 11 a.m. And then having to go the rest of the day. And then I'd have practice. Sometimes I'd have practice the night before and I wouldn't get back to like 11:30 or sometimes 12. It really depends. And so I'm like those instances and also juggling with like teaching and classes. It was a lot, but I thought I could do it because, like, oh, I can function, I can manage. But after a while, you get burnt out and it's really hard to divert your effort. And then, like, I found that I just could not give research like all of my effort, and like I wasn't as like present as I think I could have been. I didn't get as much out of it as I would have liked. Um, and so I want to just be mindful of the amount of new things you try and join before knowing like what the full commitment is like. So with research, it's like I think I would have liked to, I would have, I wanted to know like how much time it really involved because I think sometimes clubs or things, they say, oh, like your commitment is like, say 6 hours a week, but it's really like a lot more than that. And so that was another challenge I had to figure out and realize it was not sustainable. And so in future semesters, I had learned to either like maybe be a part of like lower commitment dance teams or kind of speak with my like private PI, private investigator, like, oh, this is my commitment of how much I can help with these trials and like kind of like communicate that to other people. So it's just you're not you're not putting that pressure on yourself to spread yourself so thin in a bunch of different directions.
Before we close our conversation today, I want to ask you for some advice. What advice would you give to someone in high school who is interested in pursuing a career in medicine?
Yeah, I would say firstly, it is super important to explore different areas of healthcare. There are so many ways to be involved in medicine beyond, being a doctor. There's physical therapy, nurse practitioner, physician assistant, like many other ways. And so I would say don't shy away from shadowing, reaching out to people to shadow even just for a day. I'm sure they'd be more than happy to um, have someone accommodate and like tag along, like or like volunteer in a health setting. I think you can be exposed to a lot of different types of healthcare workers. Second, don't be afraid to like ask questions and seek mentorship. I think mentorship is super important. Whether that be a like, TA you really like talking to, or I don't know, it could be like totally not academic related, but just someone who can help you like develop your interests more and someone who can kind of work hand in hand with. It's like a lot easier to do with someone just like who has your back and who can give you advice. Um, and also, I would say something that is important to recognize, and I would say is to normalize not knowing. I think um, it can be really easy to get down this track of like linear thinking as a pre-med, you have so many things to do and prerequisites and like tests to take and things like that, where it's like, I have to do this and this, and I only have um, one path and this like one timeline. But in reality, for a lot of people, it's like, oh, I didn't know I wanted to be um, like go the pre-med route until like halfway through my uh, sophomore year or like junior year. I don't even remember. So it's like okay to like not know what specific path, what specific timeline you need to be on because there's no right or wrong. Like everyone has their different paths, and in reality, like the more time you take to figure it out, I think the happier you will be. Because then you really know like what you want to do is what you want to do. And so I would say experiences where you experience something and you don't like it, that's just as valuable as, doing something you're like, oh, I do want to do this. Because then you know what you don't want, you know what you don't want to do, and you do know you want to go like this particular path. So I would say those are the pieces of advice I would pass along to people.
Yeah, I agree. I really like the go with the flow kind of mindset. I think that's hard to like achieve, but it's also been proven in like studies that um living in the present and not worrying about like the future and being anxious about it like makes a person happier. So that's good advice.
Yeah.
Is there anything else you'd like to share with your audience or any final thoughts that you'd like to leave us with?
Um, yeah, I would say that just try to find the things and little experiences and interactions with people that make your whole journey enjoyable. Really and try to prioritize those as much as you can because medicine's a long path, a long journey, and it's really not sustainable if, you know, you just study all the time and like are working 24/7. Um, each step along the way is, has a purpose. And, I think, find the little joys in things and, because it's um, something that is super important for, avoiding burnout and just like being a happier person and a more, I would say, cap not capable, but happier provider.
Okay, I really want to thank you so much, Victoria, for your time and your amazing insights. The work that you do is truly impactful and it's so amazing talking to another graduate. I really appreciate you sharing your experiences with us, and hopefully we can catch up with you in a few years to see how your journey has
Yeah.
progressed. And to our listeners, thank you for joining us on another episode of Coffee Chats with Claire. See you all soon.